Hey folks, Dr. Joe Esposito here. So glad to be with us today. What we're talking about, to kind of keeping this stream of thought going, is complementary pain management. Because so many people, when they think of pain management, it's got to be medication or surgery. Not always the case. Chiropractic, sometimes physical therapy works, sometimes acupuncture works, sometimes massage works. And so we're talking about alternatives that work real well. But I want to cover specifically the number one treatment for pain, non-surgical, non-drug treatment for pain management today, by far the number one treatment, and that would be chiropractic care. So I want to give you the amazing benefits of chiropractic care. I've kind of talked about it here and there in other shows, but man, I'm just going to lay it on the line today. I'm going to give you the benefits that I've seen happen in my career, and I've been at this 36 years, so I've seen thousands, I'm going to guess tens of thousands of patients, and I've adjusted millions of bones. So, because we adjust multiple bones on each patient. So, it's a powerful pain reliever. There are so many studies out there that when patients receive chiropractic care, their pain reduces dramatically. And again, it's by far the number one treatment for back pain. It's the most effective, least expensive. It's not going to work on everybody. But I'd be remiss to say that if you don't do it, you're going to be upset with yourself. Okay, you have to try it, I would think. And again, not everybody's a chiropractic case. People come in, I'll say, listen, you're not a chiropractic case. I had a guy come in the other day and 2 ruptured discs in his neck. He had ablations, burning the nerves. One arm is numb now. The other one is on fire because he didn't do the ablation there. But he's concerned. He's a manual laborer, so he can't move his arm as well. I said, you need to go right into PRP. I'm going to bypass chiropractic with you, put you right into PRP and some trigger point injections to calm down the muscles because he was just so tight. If we tried adjusting, we weren't going to get anywhere. It's like they said, don't put lipstick on a pig. It's not going to. Don't teach a pig to sing. It's not going to work, and you're going to annoy the pig. So same thing with that. I'm just going to annoy the patient in that case. So we sent him right over to our medical division, and he just got the treatments. I don't know the results yet, but we did PRP and trigger point injections right away. Once he's calmed down, then he would work well as a chiropractic patient. So, but most of the time we do it the other way around, chiropractic first, by far solving most problems. And I love when patients have been to other doctors and go, nobody's ever explained it like you do, Dr. Joe, or my staff. And they just become junkies. They just love chiropractic. They become little groupies. So, and you hear people talk about it all the time. My chiropractor, my chiropractor. People own us. And I love that because they're very protective of us. They're so happy with the results. My mother told me when I left for school, she says, you got to be careful in your career. She says, because people are going to just fall in love with you and worship you, not because of who you are, because my mother was never big on building up ego too much, but because of what you've done for them. She said, I remember Dr. Waltman, who delivered you and your sister. Back then, the medical doctor did everything. She says, I remember feeling such a love for this man for bringing life into the world. Now, she goes, it wasn't a romantic love. She says, but I just love this man because he brought my children into the world. And so when you do something positive for someone, they like you. And it's really one of the amazing parts of my job is that people really, in most cases, not always, most people really like getting chiropractic care. I adjusted a friend of mine the other day who's an orthopedic surgeon, and he said, Joe, you guys have a 95% success rate. That's a little high, actually, but I went with it. He says, we as surgeons have a 20% success rate. This is the surgeon talking. He says, people like you. He says, everywhere I go, people just love chiropractors, and they love you specifically. And I went, oh, that's kind of cool. And then I adjusted him. He hasn't had any pain for 3 weeks, so he likes me too now. We try to get to the cause of the problem and not just treat the symptoms. And I'm okay treating symptoms. If I have a headache, I'll take some acetaminophen. But then I want to find out why I have the headache. So when patients come to us, it can't cure everything, but we specifically look at the nervous system. And if you have a pinched nerve, it can affect the muscles, it can affect the reflexes, it can affect the bones, affect the blood vessels, affect the organs. So we try to find out why the body is malfunctioning and not just cover it up. That's why we work in conjunction with so many other doctors, because sometimes we need to cover it up so that we can get in there and fix it. Like that one patient I just told you. We need to get him out of pain so we can get in there and adjust him. Most times we can adjust him and get him out of pain. He was too far gone. So we had to work backwards with him. One of the other benefits of chiropractic care, it's drug-free. Chiropractic adjustments, totally drug-free relief. So if you're interested in an option aside from drugs and surgery, I would say chiropractic is your approach at this point. And I like it too because we have this opioid crisis and people take opioids and it works great. However, the doctors have to be careful. They can only prescribe so much opioids. They're being monitored now by the government. And I've never taken an opioid, but some people, not everybody, but some people, when they take the opioids, get addicted and they can't come off it. And a very good friend of mine is a dentist, and he's successful, and he, upper middle class and a little older than me. And we were talking one day, and he says, I wish I had met you when my wife was still alive. And I was taken back. It's kind of odd conversation to have. And he said she had pain, and she went to a pain management doctor. They gave her opioids, and she was one of those people who got addicted. She ended up going to the streets and died of a heroin overdose. And this is an upper middle class woman. Money was not an issue. She couldn't get the medication because she became addicted, and she died of a heroin overdose. So it's not a joke for some people. Other people can take the opioids, and when pain is gone, they're fine. But you don't know if you're going to become an addict or not. And so I like to try the minimally invasive non-drug approach first. And then we could always go like injections. We can do PRP. We can do exosomes. We can do several other things. But I like to start simple. And it complements pain treatments. That's why we work so closely with other doctors and surgeons. And, hey, Joe, I want you to get this person healthy so I can do surgery on him. Okay, my team of doctors will work with the patient, get them stable, and then they still need the surgery. And then after the surgery, they come back to us and we do the repair work as well. So it's a complementary treatment when it comes to that, working so well with other doctors. Dentists send us patients for TMJ pain. Headache doctors send us their patients. It's just another pain management tool, but it's an extremely effective pain management tool. And we can customize the treatments. Sometimes people need their neck adjusted. Sometimes they need their foot adjustment. Dr. Kat, one of my doctors, was just telling me, she runs our Duluth office. She was telling me that this woman had tight hamstrings. So she said, I'm going to try and experiment with you. And we usually get along very well with our patients. So Kat only adjusted her feet. Dr. Kat did. Adjusted her feet, and she was able to touch her toes after adjusting her feet. Never touched her hamstrings, never touched her back. So sometimes it's a foot, sometimes it's a knee, sometimes it's a shoulder, sometimes it's the skull. I was trained by Bertrand Desjarnais, the founder of chiropractic, craniotomy, working on the skull and cranial manipulations, and he showed me how to adjust the skull, which is really cool. So moving skull bones can actually be done. 206 bones in the body, any one of them can come out of place. It's very low risk. The biggest problem people have is maybe after their first adjustment, they might have a little stiffness or soreness. But the risk it's there. There's risk in everything in life. I'm not saying it's totally risk-free, but extremely low risk. And so patients like that because there's interventions that have to be done sometimes after surgery because the surgery was successful, but then scar tissue formed. Chiropractic care, relatively safe across the board. Not saying it's 100% safe, but it's relatively safe. 66% of people in a study perceived great benefits from their treatments early on in treatment. Fox News, this was an interesting one. I like this. Fox News said, chiropractors are best known for safety and effectively treating acute neck and back pain as well as headaches. Medical doctors might prescribe pain medication, muscle relaxers, and anti-inflammatory drugs. An orthopedic doctor might suggest surgery. A chiropractor will treat the problems by hand using manipulation of the spine. So again, there's different ways to do it. Drugs, surgery, there's physical therapy, there's acupuncture. But I think chiropractic, in my opinion, is the starting point when it comes to pain management. And I can't imagine why it's not. Now, there's one insurance company, it just came out. I want to say it's United Healthcare, but I'm not sure. They're saying that before you can even do more aggressive pain intervention, you have to see a chiropractor for at least 6 visits. I think that's brilliant. I've never said a nice thing about an insurance company until just then. Finally, they're getting it. It's more effective and less expensive. Why are they not starting with this and then escalating care? They cover these crazy things, but they don't cover the things that work so well. So finally, it's coming around and we're starting to see it. And it's the almighty dollar that drove it. The almighty dollar is saying, hey, listen, if I'm going to save money to get, Garrett well, I'm going to send him a chiropractor first. So that's another one of the many, many, many benefits of chiropractic care. It's also an option for cancer patients. Now, Cancer Treatment Centers of America said one of the benefits of chiropractic care is cancer-related symptoms and pain. I am not paid by Cancer Treatment Centers of America. I'm a big fan of theirs, though. I like them. I like the work they do. They work with medicine. They work with nutrition. They have chiropractors on staff. In fact, there's one of them has even asked me to be on staff. I just don't have time to do that, the one in Atlanta, the Cancer Treatment Center of America. But I like them, and that's an unbiased, unsolicited promotion for them. Cancer and treatments for cancer can be very stressful to the musculoskeletal system, and that's where chiropractic care comes in. Chiropractic care can help reduce stress, increase mobility, flexibility, strength, and function, as well as help improve overall well-being. So even though we're not treating the cancer, we're treating the cancer patient. And I like that. We have a lot of cancer patients come see us, and it's wonderful because it helps. Chiropractic can even help with the immune system. So there's no reason not to include things like chiropractic care in your treatments, whatever it is. And that's why I'm really excited about that. It can improve joint function. If the joints are locked out of place, whether it's your knee, your shoulder, your spine, your hip, the bones, swelling occurs. Swelling occurs to protect that area. So the swelling occurs to protect the area. The swelling then locks the bone out of place, which pinches the nerve. The pinched nerve prevents the joint from moving, and now you're caught in this cycle. And so chiropractic care mobilizes the joints. And the key to anti-aging, the key to staying young is mobility. If you ever held a child, they're like rubber. They can fold them in half. I remember being a kid, my sister would wrestle with me, and she'd fold me in half, and my mother would laugh. How do you do that? Doesn't that hurt? And I'd laugh and giggle. As we get older, we can't do those things anymore. So mobility is the key, and chiropractic adjustments mobilize the joints. And that's really exciting because the joints are mobile. They're less likely to pinch nerves. They're less likely to wear out. And you're able to do more things. That's why it really is part of an anti-aging protocol. I can't imagine chiropractic care not being part of any anti-aging protocol. How many people would like to live longer? Raise your hands. How many people would like to live a happier, healthier life? Raise your hands. Well, these are some options that might work for you. Chiropractic, nutrition, and digestion. Those are the three things I feel everybody needs in order to obtain and maintain good health and to stay young. We treat a lot of conditions. I've had many patients over the years with fertility issues, men and women. And the nerves in the low back control the colon, the sex organs, and the bladder. So it might be functional, if trying to keep it clean here. When it comes to romance, it might be the organs not working. Could be a sperm issue, could be an egg issue. And by adjusting the nerves in the low back, you open up the nerve supply to the organs. There was one lady many years ago, her name is Mary. And I remember I was early on in practice, so it really made an impression on me. And she couldn't get pregnant. And her husband wanted to spend the money on fertility treatments, and she wanted to go to chiropractic because she had back pain. She didn't come to me for fertility treatments. So I treated her for a while. She had a son named Crispin, I remember. I remember that strange name, Crispin. Anyway, the reason I remember that is she came in one day, and she was smiling. And I said, "You're pregnant, aren't you?" And she said, "How do you know that? I haven't even told my husband yet." And I said, "You got that look in your eye, Mary. Woman's got a certain look." And she crocheted or embroidered a sweatshirt that said, "Dr. Joe got me pregnant." And I said, "Mary, you can't wear that." And she wore it every day, I think, of her pregnancy. And the baby, when he was born, was named Crispin, I remember. But very exciting. And that's one of many, many, many success stories for men and women that we've had with reproduction. Headaches and migraines, ear infections, menstrual disorders, gastrointestinal problems, acid reflux, heartburn. All my doctors are trained by me to take the stomach and actually adjust the stomach. We can pull the stomach down away from the diaphragm. When you pull the stomach down away from the diaphragm, it helps acid reflux, heartburn, digestion. And the reason I've trained all my doctors to do this is because I have this condition. And when I get my stomach adjusted, and it's very rare now I even need it, it's bloating goes away. I don't feel fat anymore. I can eat normal amounts of food. My brain works better. There's no downside to getting that stomach adjustment unless you're not a candidate for it. We screen you for that. But it's amazing. And I'd say 85% of the patients I've tested in my career have digestive issues. And many times it's a physical problem, not a chemical problem. And so physically, we can adjust the stomach, adjust the small intestine, adjust the ileocecal valve, adjust the nerve supply to the organs. The results are phenomenal in many cases, not always. We can help get you back to work faster after a car accident or a sports injury or a work injury. So that a lot of insurance companies like because when people get back to work faster, they don't have to pay them disability. You like it because you get your life back. And we don't like malingerers, by the way. I've caught a few over the years, and I won't treat them. So my father was in a horrible accident before I was born. He broke his back and fractured his skull and went deaf immediately. So my father never heard my voice. And he was able to walk and talk, but he was deaf my entire life. And it breaks my heart thinking about it now, how all the years he'd sit at tables, and this is before the internet, and this is before closed captioning, and he'd just sit at a big Italian family, and he'd just sit there and just look around because he couldn't hear anything. And it broke my heart. And one time, I remember this, I was a child, and the workers' comp company, they were paying him $73 a week in workers' comp, really killing him. They sent him to a doctor for what's called an independent medical exam. And the doctor stood behind my father. My father was a little short Italian guy. And he said, "We know you're faking it. Get the lead out of your blank." And my father didn't hear it. He didn't move. Now, you get an old Italian, you talk about that, he'll turn around and slug you, right? So after the doctor left the room, my mother told my father what the doctor said. The doctor walked back in the room. My father threw the guy up against the wall. He said, "You ever talk like that in front of my wife again, I'll kill you." My father was still considered deaf after that, and we still got out $73 a week in workers' comp payments until my father died. But the insurance companies are always looking for ways not to pay, and I don't blame them. I understand there's a lot of malingerers out there. My father was not a malingerer. He was truly deaf. So if you're in an injury, workers' comp or auto accident injuries, you want to come see us right away. The quicker you get to us, the better it's going to be, because the insurance companies, again, are looking for ways not to pay. That's their job. Our job is to prove that the injuries are real. And so if you're in an accident, you want to come see us as quickly as possible, because we want to get you well and keep you well, and we want to make sure that you're getting the best care that we feel you can get anywhere in the world. And if you do want to make an appointment, by the way, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. My doctors, I feel, are some of the best in the world. The initial visit was $375. We've reduced it to $199. That's an exam, x-rays, consultation, your first chiropractic adjustment, going over the x-rays on your next visit, and a complete nutrition evaluation. Nutrition alone is $150. So if you want to get well, and listen, folks, it's not going to be a one visit and done, just so you know. If you think you're going to come in one time, if we find something wrong, it's going to take a series of adjustments to fix it. We're talking 8 weeks, maybe 10 weeks. We're not talking forever, but don't come in thinking it's a one and done. Don't waste your time. Don't waste your money. I'm telling you right now. We accept most insurances. Like I said, car accidents, folks, if the car was damaged, you were damaged. In my experience, if the car was damaged, you were damaged, you got to get to us right away. We accept most insurances, Medicare. Most of our doctors are in most networks. We're getting all the doctors in networks. We have medical treatments as well. Go to our website, drjoe.com. Click on the link that says services, and you can see all the services that we offer: weight loss, nutrition, chiropractic. Many chiropractors, not all, are very good at nutrition. I am. I'm pretty good. I got 4 degrees in nutrition. So most doctors are very good at nutrition, but if you need nutrition evaluation, even if you're seeing another doctor, we can do nutrition consultations over the phone or in person. And the minimum supplements I suggest everybody take, just a base level nutrition, will be Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. They taste great. I like the mint flavored Super Greens. There's plain as well. I like the mint. Personal opinion. I take a scoop of each. I shake it up with some water, some coconut milk, almond milk. I have it every single day. If I have a busy day, I may take a second dose. I also take nitric oxide every day to open up my blood vessels and increase circulation. Because again, we have to have joint mobility, but we have to have good circulation. And as you get older, your nitric oxide levels drop. Opens up the blood vessels. Many patients say it helps lower their blood pressure. I'll take 2 in the morning, and then sometimes in the afternoon, I'll take another 1 or 2 if I have a big day, if I got exciting things going on. It gives me an extra burst of energy. So it's really helpful. A lot of men tell me it helps them tremendously in the romantic department. So if you take a nitric oxide or 2 a few hours beforehand, a lot of men report back that it works really well, and women too. So nutrition is part of what we do in our office as well, and it's another benefit that a lot of doctors don't even know. They'll say, Joe, they'll call me up and say, Joe, I need a nutritional evaluation from you, man. I went to medical school 12 years, learned almost nothing about nutrition. It's not their fault. I'm not picking on them. It's just that they may not have that training. Like I'm not trained in injections. I have to have my medical staff do the injections, the PRP and things like that. The pain management, the ablations, the nerve blocks. I don't do that. I know it works, but I don't do that. And so we're really good at nutrition though. So, and we have a network of doctors that we're putting together, by the way, a network. It's going to be on the website very shortly of doctors. We're going to start with the Atlanta area and then go to other areas around the country. And it'll be chiropractors, orthopedists, neurologists, neurosurgeons, psychiatrists, imaging centers. We're going to put together a whole referral network because people don't know where to go. And we're going to help you with that. That's coming up next. Garrett and I just started working on it a couple of weeks ago, actually. Talking about the benefits, the amazing benefits of chiropractic care. It's non-invasive. It's targeted applications, which means we treat just the area that we need to. We don't go racking and cracking the whole body. Like I said, we provide nutrition evaluations. It's great preventive care. And that's the thing I want you to get to, is that once you're stabilized, we have a lot of patients come to us maybe once a month for tune-up. You're going to do things to throw yourself out of alignment. It's being human. Lifting, bending, squatting, housework, yard work, sleeping wrong, stress, eating wrong, long car drives, slipping and falling. One of my doctors slipped on some stairs the other day and hit her arm. So we x-rayed it. It wasn't broken, luckily. But we had the x-ray machine there. We took the x-ray, and so we were able to get her under control right away, and we splinted it, and she did great. We adjusted the shoulder. We adjusted the neck. We opened up the nerve supply to the shoulder. So it really is a preventive treatment plan, but it's also good for acute injuries as well. Chiropractic can boost your immune system. A lot of people don't realize that, but adjustments can actually stimulate your white blood cell activity. Mental health. I cannot tell you how many patients we've seen over the years with mental disorders. When you fix their digestive system, they're able to absorb nutrients properly, especially acid reflux and heartburn patients. Proteins are then broken down into amino acids. The amino acid tryptophan becomes serotonin, tyrosine becomes dopamine, and glutamine becomes GABA. GABA helps suppress pain. So many times we have to fix the patient's digestive system in order for them to produce the right neurotransmitters so that they're able to manage their brain function better. How cool is that? So that's another amazing benefit of chiropractic care. We've had a lot of patients reduce their blood pressure with chiropractic care. We adjust them. We fix their digestive system because the digestive system is controlled by the vagus nerve, and the vagus nerve also controls blood pressure. So if we take the stress off the vagus nerve, many, many patients said their blood pressure goes down. We get them on Super Greens, Essential Source, and nitric oxide as well, supplement-wise. So chemically and physically, we're managing this case. And then when they're low enough, they can go to their medical doctor and get off their medication. Pretty cool stuff. A lot of patients say they sleep better, restless leg syndrome, difficulty breathing. Chiropractic care does amazing things for sleep. And many times you're just in pain. So you get them out of pain, they sleep better. Increase energy levels. I love this part about chiropractic because so many people are tired all the time. Pain is exhausting. Even low-level pain, chronic low-level pain is exhausting. When we are able to manage that without drugs and surgery, in many cases, they're thrilled with the results. So I can't imagine why people wouldn't get chiropractic care. I still can't imagine why anyone wouldn't be getting a chiropractic evaluation. This blows my mind. So my goal in my life is to make people understand that there are complementary healthcare services available, and that's what this show is all about, that are available to you that you don't even know exist. So I would say chiropractic first, drugs second, surgery last. Not against surgery. I've had surgeries. Only if it's necessary. And that's what I want you to understand. It's a whole lot cheaper that way too. So many athletes, Tom Brady, Michael Jordan, just to name a few, said they wouldn't be where they are without chiropractic care. It works for everybody from kids to seniors. I've adjusted a baby fresh out of the womb, and I've adjusted one patient, I think our oldest one was 107 years old. So there's nobody who is not a candidate for chiropractic care. They may need other treatment as well, but everyone has a spine, everybody has joints, and chiropractic care is the thing that puts it back in place. Folks, if you have any questions, send them to me through the website, drjoe.com. Please, I'm begging you, follow us on social media. We need your help to get a bigger following. At Dr. Joe Esposito, Facebook, Instagram, and YouTube. And if you want to make an appointment to come see us, the exam, x-rays, consultation, first adjustment, going over the x-rays, and the nutrition evaluation, $199. Treatment after that should be covered by most insurances. You can book right online, drjoe.com. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. Folks, thank you so much for tuning in. I'm Dr. Joe Esposito. Again, our website, lots of information, drjoe.com.